Healthcare coverage in the United States before and after the Affordable Care Act. On March 23, 2010, President Barack Obama signed the Patient Protection and Affordable Care Act into law. This law is commonly referred to as Obamacare. Despite the fact that many of the law's provisions have been in place for the better part of a decade, the ACA continues to be hotly debated and contested on the political stage. President Obama's plan was built on the current U.S. healthcare system, which is a combination of private systems, Medicaid, Medicare, and military healthcare. The ACA was created with three basic aims: to establish universal or near universal healthcare coverage for citizens of the United States, to control the cost of healthcare, and to improve the quality of care. The purpose of this video is to focus on what has happened with the health insurance coverage of Americans since 2010. President Barack Obama expressed a commitment to establishing universal health care coverage during his presidential campaigns. In 2009, standing before a joint session of Congress, he said, "I am not the first president to take up this cause, but I am determined to be the last." A recent Kaiser Family Foundation poll asked Americans about the uninsured rate in the United States. The poll showed that 21% of Americans think the uninsured rate is at an all-time high, and 46% of Americans think it is the same as it was before the Affordable Care Act was passed into law. Only about 1 in 4 Americans think the uninsured rate is at an all-time low. In other words, the majority of Americans think that healthcare coverage has either worsened or stayed the same since the Affordable Care Act took effect. The objectives for this video are to discuss the provisions in the Affordable Care Act that are intended to expand coverage to more Americans, to discuss the distribution of healthcare coverage before the Affordable Care Act, to discuss the distribution of healthcare coverage after the Affordable Care Act. Has the Affordable Care Act achieved universal coverage? And then we'll discuss why Americans remain uninsured. In order to achieve universal coverage, the ACA established certain provisions. The young adult provision took effect in 2010 when the ACA became law. Under this provision, young adults can remain dependents on their parents' insurance plans until they turn 26. The Medicaid expansion is a provision that took effect on January 1st, 2014, and it required states to expand Medicaid to those earning up to 138% of the poverty level. That's about $28,000 per year for a family of 3. The federal government promised to pay for 100% of the cost of coverage for all of the newly eligible enrollees up until 2016. The American Health Benefit Exchanges is the health care marketplace that took effect on January 1st, 2014. The marketplace offers private insurance options for people who are not eligible for employer-based insurance or government-based coverage. People with incomes from 100 to 400% of the federal poverty level are eligible for cost sharing and tax subsidies so that health insurance can be affordable. The employer requirement is a provision that was phased in between 2015 and 2016. It requires businesses with at least 50 full-time employees to provide coverage for at least 95% of their employees. Businesses can either choose to expand coverage or pay a penalty. Inability to deny or drop coverage based on pre-existing conditions. Prior to the passage of the ACA, insurers could, and often did, deny a person coverage or cancel their existing coverage based on a pre-existing condition. Under the ACA, insurers cannot deny coverage or charge more because of health status, and they cannot impose lifetime limits on coverage. And one of the most hotly debated provisions in the ACA is the individual mandate. This provision took effect in 2014. All individuals, with very few exceptions, are required to have insurance or pay a penalty. The purpose of the mandate is to make sure that the pool of insured individuals includes both healthy and sick people. Now let's look at the distribution of healthcare coverage amongst Americans. We will start with 2010, when the ACA was signed into law. At this point, only the young adult provision has gone into effect. The majority of Americans, 55.3%, were covered by their employers. 9.8% of Americans purchased private health insurance directly. So a total of 65.1% of Americans were covered by private insurance. A little over 1/3 of Americans were covered by some form of publicly administered health care, either Medicaid, Medicare, or military health care. While a majority of Americans had some kind of insurance coverage, 16.3% of Americans had no coverage at all. That's almost 50 million Americans. You'll notice that these percentages add up to more than 100%. This is because people often have more than one type of health insurance at the same time. For example, a person may be receiving veterans' health benefits and at the same time may be employed and covered by private health insurance through their employer. Now let's look at 2015. By this time, the Affordable Care Act has been a law for 5 years. Most of its provisions are in effect. The employer requirement is being phased in. The majority of Americans, 67.2%, still have private insurance, with 55.7% insured by their jobs and 16.5% with directly purchased insurance. 37.1% of Americans were covered by a public option, with 19.6% of Americans now covered by Medicaid, 16.3% with Medicare, and 4.7% with military coverage. We see an increase in coverage due to the directly purchased private health insurance and Medicaid. This is likely due to the individual mandate, the healthcare marketplace, and the Medicaid expansion. All of these are provisions in the Affordable Care Act. As for the uninsured rate, 9.1% of Americans were uninsured, a historic low for this nation. Still, as of 2015, there are approximately 28 million Americans still without health insurance. With all of the Affordable Care Act's provisions in place, why are there still millions of Americans living without insurance? The first category includes uninsured individuals who are outside of the Affordable Care Act's coverage because they are in the Medicaid gap. All 50 states were expected to comply with the Medicaid expansion. But a Supreme Court ruling in 2012 found the Medicaid expansion mandate unconstitutional. So, instead, states were left with the option of expanding Medicaid eligibility to their citizens. At this time, 32 states, including the District of Columbia, have chosen to expand Medicaid. 19 states have chosen not to expand Medicaid. So how has this impacted coverage for individuals living in those 19 states? In most of those 19 non-expansion states, you have to be at less than 44% of the federal poverty level to be eligible for Medicaid, which is a little less than $9,000 per year for a family of 3. Childless adults are typically not eligible. Recall that one feature of the Affordable Care Act was to expand Medicaid coverage to individuals earning up to 138% of the federal poverty level, or approximately $28,000 per year for a family of 3. In addition, the law's drafters, who didn't anticipate that a Supreme Court decision would make the Medicaid expansion optional rather than mandatory, made subsidies available only for individuals earning between 100% and 400% of the federal poverty level, or up to approximately $90,000 per year for a family of 4. What this means is that people living between 44% and 100% of the federal poverty level are left without any insurance options in those 19 non-expansion states, because they aren't poor enough to get Medicaid, but they're also below the eligibility rate for marketplace subsidies from the government, which start at 100% of the federal poverty level. This is known as the Medicaid gap. How many people fall into this gap? The number is estimated to be about 2.5 to 3 million people. As I mentioned earlier, about 28 million people continue to be uninsured. Approximately 2.5 to 3 million fall into what is referred to as the Medicaid gap. Who are the rest of the approximately 25 million people, and why are they not insured? Well, a second category is undocumented immigrants. The Affordable Care Act doesn't provide health care coverage to the estimated 5.4 million undocumented immigrants living in the United States. A third category, an estimated 12 million people, are eligible for Medicaid or subsidies on the marketplace. They may be uninsured for a variety of reasons, such as being worried about the cost of having insurance, or not realizing that they are eligible for financial assistance from the federal government. They may not even know what they are eligible for, and some of these people may be choosing to opt out of getting coverage. Finally, about 7.5 million people fall into the category of people with access to employer-based insurance and people whose incomes are too high to be eligible for Medicaid or marketplace subsidies. Some of these people may be uninsured by choice. So what we have here when we look at who is still uninsured in this country are 3 broad categories of individuals. The first category of individuals, those in the Medicaid gap, were intended to be covered under the law as it was originally drafted, but due to the combination of a U.S. Supreme Court decision and decisions made by individual state governments, they don't have insurance. The second broad category, undocumented immigrants, are individuals who were never intended to be covered under the law as it was drafted. And finally, the third largest category of individuals are those who are eligible for coverage under the law, but for the various reasons I just described, have not obtained insurance. Addressing the issues faced by these various categories of uninsured people can help us ensure that even fewer people are without health care coverage in the near future.